Welcome to the HBOT News Network. I'm Ed DiGirolamo, and today I'm honored to have as our guest Dr. Robert Beckman. Dr. Beckman has been involved in the HBOT industry for nearly 2 decades, maybe more. We'll hear more from him. So one of the things that struck me about Dr. Beckman is that he has an interesting background, and it's not originally in the medical field, much like myself being an engineer. He's very, very involved in data, and I think that data and the data that this industry has out there and collecting it is something that piqued his interest and attracted him to it. And then certainly much more than that, especially when it came to our veterans. So welcome, Dr. Beckman, to our conversation.
Hi, Ed.
And so maybe you can give us a little more background on yourself and what brought you into the hyperbaric world.
I can peg it to a specific time and even day. Back in 2008, there was a scandal at Walter Reed. They were throwing vets out, other non-honorable discharges. Suicide rate was in the front page of the paper, and Walter Reed scandal eventually wound up in a Pulitzer Prize story for the Washington Post. Guys with brain injuries, mental health issues is the way they describe them, were quite literally being thrown out of the military, other non-honorable, for all kinds of bogus reasons. And those discharges meant they had no health insurance. That was it. And it was in the middle of the presidential campaign. I was working a Black Ops program, and I was absolutely incensed, and I was literally storming around the floor, and a whole bunch of pilots and spec ops and whatnot from primarily military and PsyOps folks. And one of the F-111 pilots looked at me and said, "Beckman, if you're so angry, why don't you do something about it?" Well, that was the throwdown. So I called Dr. Mosiani, close friend, and said, "We got to do something about this." He said, "You need to come to a meeting with me." And within 2 days, I'm meeting with Dr. Paul Harch, Dr. Bill Duncan, Steve Reimers, Secretary Marty Hoffman, whole gang. There were 8 or 9 of us sitting around the table. And this was in 2008. And I was intrigued by the conversation because, as anybody in the HBOT world knows, there's an awful lot of pent-up anger and frustration and talk. And I'm an action guy, rapid prototyper, big data, knowledge management, deliverables. So I'm listening to the conversation, and it wasn't going anywhere as far as I was concerned. And I said, what's our end goal? Why are we meeting here today? And one thing led to another, and we left with bunch of action items. And one of the action items fell directly into my bailiwick of we had to get a platform together to collect data for the clinical trial that everybody agreed we had to run. And so we put together the National Brain Injury Rescue and Rehabilitation Study, and after about 6 months of unbelievable paperwork, we got the IRB in place and the protocols and all of the background to actually declare on clinicaltrials.gov that there was a study and that we were recruiting. That also meant that we had to put a network of chambers together because we didn't have a chamber, and remembering that everybody working the project was working pro bono.
Well, let me circle back then.
Sure.
So you're at Walter Reed, you're at the hospital, and so I'm curious, did they have a chamber there?
No.
So okay, they didn't have a chamber there.
But that's an interesting question because General Pat Maney had been blown up over in Afghanistan, Judge Maney, and he was working side by side with Marty Hoffman, Secretary of the Army, former Secretary of the Army, and Marty and he were trying to build the legal infrastructure and superstructure for the legal system in Afghanistan. Pat Maney, General, was blown up. and wound up at Walter Reed in, I think, '06. And Marty felt miserable about it. And Marty reached out and found a chamber at GW. And Pat Maney, General Pat Maney, Judge Pat Maney, was the first veteran treated with HBOT at GW.
Were you aware of that? Did you
No, I didn't know that
so
at
you
the
didn't
time.
know- so, okay, so they don't have it at Walter Reed.
No, none in the VA.
So Dr. Mazzioni?
Mozzaieni.
Mozzaieni.
Yep.
So you called him.
Oh yeah.
Why did you call him? Like was he?
Well, he's
Hyperbaric
a blood brother. He didn't know about HBOT at that
He
point.
didn't either. Oh,
No.
okay.
And
So then how did he get you into this meeting? Like at what point did you even learn it was about HBOT?
well, he had been talking with Steve Reimers and
Who makes chambers? Or
who
at
makes
the time? Maybe.
Yep. And I forget exactly. As I think about it, he had been considering HBOT because he's a medical magician, and he knew that HBOT was going to be effective on Lyme disease and other bloodborne pathogens, and he knew that inflammation sits beneath all diseases, and so he had an inkling. Mm-hmm. So the connection to that meeting through Bob led me on this journey, now 14 years, of direct involvement with getting answers to some simple questions.
And so I understand that in the meeting that you went to.
Yep.
Was that up in D.C. or was that?
Yep, right across the street from the NIH.
So how did you get one of the world experts in it, Dr. Harch, at that meeting? Was he happen to be there, or did they fly him in?
Well, I may have the attendees at that meeing wrong, but there were a series of meetings, and I learned about the IHMA and the IHMF, and the gist of the meetings was this has got to get organized, really organized. Sure. And so, being the kind of person I was then and now, there's got to be deadlines and ABCs. And so, little by little, we built the infrastructure that started with 9 clinics, just calling around, soliciting Eddie Zant and a whole range of really good people, and Paul Harch and so forth. And we started with 9 clinics, and today TreatNow is over 135 clinics, loosely organized, emphasis loose, but treating and healing veterans for gratis or donations or reduced rates.
So the NBIRR study, NBIRR, so the National Brain Injury Rescue and Rehabilitation Study.
Right.
That's what came out of that meeting, and so you were involved in developing the systems that would collect the data. And
Sure, and there are so many pieces to running a clinical trial, and it wasn't just focused on a clinical trial.
Did you have experience with that?
Yes, in a direct and indirect ways, but I did not have a sense of how laborious it was going to be working with the FDA and getting the clearances and understanding. And Paul Harch was a great help, and Bob had worked at NIH, and so
even the IRB, the Independent Review Board.
Yep.
Right. So
Institutional Review Board.
Is that what it's called?
Yeah, out of WIRB, the Western IRB.
So they're independent.
They're independent. There's safety. So, and we had to get money and all kinds of chatter and noise to quite literally say we're soliciting people. So when all was said and done, we wound up with 32, started with 89, and we had good data on 32 people from 5 different clinics, really solid data. And the impetus for NBIRR for me personally was we're going to stop the suicide epidemic by healing brain wounds. That early for me, it was crystal clear in talking with Bob that we were dealing with wound healing. And we knew that we could stop suicidal ideation after NBIRR. because it was clear, even though it was subjective and we weren't doing SPECT scans, we weren't doing EEGs, it was an observational study.
But isn't that the direction the FDA has gone anyway? Is that, from what I understand, that subjective studies can lead to approvals or clearance to use, for example, in this case, a medical device, which is a chamber and oxygen for a specific indication, a brain injury. Isn't subjective information something the FDA does actually utilize to approve applications?
In the evidence pyramid, the non-randomized controlled trial data is less golden, less solid, but nevertheless qualifies as level 4, level 3 evidence. Mm-hmm. Level 1 evidence, randomized, controlled, blinded, etc. studies. And the good news is that in that evidence pyramid, all data counts at some level. And so an observational study, while not gold standard, is in the hierarchy of yes, and it leads from phase 3 to phase 2 to phase 1 studies, wherein, and they get increasingly larger and more expensive, et cetera. And we knew that the observational study was a down payment on a real randomized controlled trial.
Well, I think, to me, the biggest concern might be safety. And so I believe that studies like that could prove it's safe.
Well, here's the interesting thing. While we were doing all of this, there was a amazing, no coincidences, but there was a major government-sponsored meeting on the safety of hyperbaric oxygen therapy. And in 2008, they issued, right around Christmas, a study which declared all services, HBOT is safe. We had over 30 years of experience, 30, 50, 60, 70 Navy diving tables about the safety of hyperbaric oxygen.
Well, for them to say that hyperbaric is not safe, that we would have to end all diving.
Well, let's not go too far into facts versus reason versus belief versus culture. And the culture now in medicine generally is it can't possibly be true.
Oh, yeah.
Can't possibly be true, despite the evidence. And we can talk at great length about the evidence that we have accumulated. I should say that NBIRR and the number of clinics, we've been polling the clinics, and already we're over 12,500 success stories from the 130 plus clinics of individuals with brain injury, TBI, PTSD, concussion, PCS, with 40 dives.
So, for me, I don't know how how you get through the day knowing how many suicides there are and how much proof there is of what this means, because it's clearly a path forward to a fully executive function life, or at least an improved executive function. And of course, looking at so many studies now, the loss of anxiety and depression, the increase in hope and happiness, and just people's general ability to function improves overall. That with that amount of proof, it must be disheartening to know that they're just not going full steam ahead.
Well, this is a marathon, not a sprint. No one could have ever convinced me to do this if I knew it was going to take this long. But every day I'm optimistic because we keep gathering more evidence worldwide, and not just for brain injury.
So about the NBIRR study, to me, is that that you've raised, is that so it took this time to pull this together, this group. Who funded it? Because I know it's very expensive to do these studies with the FDA. Who's funding hyperbaric oxygen studies?
Well,
The government, they're funding it.
Well, okay.
No.
The government starting in 2008, because they agreed that the efficacy of HBOT was not proven. So the government got started on its studies. And over the course of the next nearly a decade, the government sponsored at least 5 major clinical trials. They declared them randomized controlled trials in most cases. They spent in excess of $126 million on those studies. And there's some amazing stories we dug out about the waste. But that amount of money over that period of time, the government expended for about 720 subjects who went through those 5 studies.
So they funded NBIRR?
No, not at all. No, NBIRR was out of the blue attempt to lay down a record, an observational study of putting people into, and we built a protocol that it was 40 dives at 1.5 atmospheres, Paul Hart's protocol. And we got 9 clinics, but the data were only good for 5 of those clinics. Started with 89, and we wound up with 32 really good subjects, really good data. How was it paid for? Credit cards, our own personal funds, donations from individual clinics and individuals. The amount of money was not severe, under $100,000, but the amount of attention to detail, we paid very close attention to detail, my background in data. And so we had really good data, but it was only an observational study. We didn't have crossovers.
And the motivation here was really to deal with the suicide rate you were seeing with the veterans and the problems in the VA.
Precisely right. And
Walter Reed, is a VA or that's
no, that's
a
active duty Army, now closed. It's now Walter Reed, Navy Bethesda, and so forth.
Okay.
But the treatment of what they called mental health issues, there's a long story to how medicine in general has been dragged around to recognizing that TBI is something that has to be paid attention to, and that TBI and blast injury and war are related somehow. Imagine that. It's kind of like the NFL holding out that, no, smashes to the head don't cause concussion. Can't prove that. So we were in the business of demonstrating with the NBIRR study National Brain Injury Rescue and Rehabilitation. Thank you, Dr. Bill Duncan. And that study was focused on understanding mechanisms of action to the extent that we could tease those data out, but the before and after of people with demonstrated and diagnosed PTSD and or TBI, mild TBI, and that's a real long story of mis and maldiagnosing some of these patients. But at the end of the study, we had objective data from NBIRR and CNSVS and subjective data from questionnaires throughout the entire process. And that process we had hoped would go on and on and on as we got more money. There was a hiccup in the midst of the study after about 3 years, and just finding patients to put into the study and so forth was very difficult, still is. But the hiccup led to the Western IRB doing its job, asking some questions, which led back to the FDA, which led to a decision that we all made that we could not pay any more money for what they were asking us to do. We didn't have the money to do more extensive rewrite of the protocol and so forth. So we ended the study.
What about all that 120 million that was out there the government's putting towards this?
No. Government contracting is very interesting, and the amount of money that was sunk into the studies that the military was doing, interesting that so much money resulted in the findings that they came up with. Contrary to most of the rest of the world, the Army declared after those studies that HBOT does not work.
Mm-hmm.
And
Let's cut to the chase. Why doesn't it work?
Because their statistical analysis is rooted in a fundamental flaw, which at this point is now, could be considered a lie about the sham which they used in their study. The UHMS, Undersea Hyperbaric Medical Society, has on its webpage a definition of hyperbaric which flies in the face of physics. They declare in writing that medicine, hyperbaric medicine, only begins at 1.4 atmospheres of pressure. That has been disproved as recently as last month with Kent McLaughlin's findings, but has been disproved all over the world. It violates the laws of physics and biochemistry, by the way. So they declared they had a sham, and because of the use of statistics to compare the control group and the treatment group, the P factor, the differential that they would have liked to have seen, i.e. sugar pills don't cure you and our drug cures you, everybody got better. They say it in their study, their conclusions.
Everybody
got better.
So
However,
even a little bit of pressure.
However, no. Everybody got better. We think because of the placebo effect, and studies underway as we speak, the ritual of hyperbarics.
Oh, yeah.
That's the phrase, the ritual of hyperbarics.
So if that works, then why not keep doing it?
Well, we can do cheaper rituals. We can care for people with brain injury in a different way. We can talk to them more. So now we're back to talk therapy. And we can take them off of their job for a longer period of time.
We can convince them.
We can convince them that they're better. But I'm getting a bit ahead of myself because the ritual of hyperbaric didn't appear until year 7. Before it was, does this work or doesn't it? No, it doesn't work because we can show that everybody's getting better. Therefore, hyperbarics isn't the cause. It's got to be something else. So they blamed it on the placebo, they blamed it on rituals, they blamed it on anything other than hyperbarics is working. And what's interesting about all of their studies is it appears they don't understand the mechanisms of action, or if they understand the mechanisms of action, they don't understand the role of oxygen under pressure, hyperbaric oxygenation, and the role that oxygen plays in the wound healing process.
So they don't, or they don't understand it, or they don't want to acknowledge it?
Well, here's interesting. Language is.
But do you think they're smart enough to understand this?
Here's language is very, very important. The hyperbarics is on label for wound healing. And there are 4 indications which are very, very close approximation to brain injury. Compartment syndrome, as an example. Non-healing wounds, as an example. One could argue that decompression sickness got to have something to do with the brain.
What about radiation necrosis?
And
isn't that an injury? It's
so,
a wound?
Wound healing. Nowhere in the literature related to Army studies do they talk about wound healing. Here's another fun factoid. In all of the protocols, as one example, the concussion protocol in the NFL, the NHL, FIFA, etc., concussion protocols nowhere in the world use the word oxygen. Concussion protocols are all about return to play and phased waiting, watchful waiting. That's the phrase. Yeah. They never talk about brain wounds, never talk about oxygen. And military medicine plays the same game. It's a mental problem, not a physical problem.
when in fact it is a physical problem?
It is both. Truth be told, the PTSD diagnosis, there's a famous 60 Minutes segment with Major Ben Richards talking to General Corelli. And General Corelli, and it was on 60 Minutes several years ago, talking literally about Ben's genius IQ and his role in the awakening. And I mean, he was a hero. And then he was blown up and written up in the New York Times, Ben Richards. And he fought for, and General Corelli, to his credit, fought for Ben getting a Purple Heart for his brain injury. There's a long, involved story of how people with brain injuries were somehow malingerers and therefore did deserve Purple Hearts. So they didn't understand. But General Corelli literally went like this. He said, I was gobsmacked when the professor out of UCLA told me what happens in a blast. And the doc told him that there was physical injury occurring. And I mean, gobsmacked that this was happening. Of course, back in 1924, a study had been done on World War II, all about blast injury, talking about physical injury.
Okay, so physical injury, but the physical injury leads to what is now looked at as like PTSD, the mental issues that come from the physical injury. Well, but a lot of individuals, at least that I've met, were soldiers. They didn't have any mental deficiencies, not even ADHD, none of that. Okay, and then they had the
pre-injury.
Then they had the blast,
Yep.
and then they have anxiety, depression, can't sleep. All these things were the result of the physical injury, which then manifests itself and cascades into more of what you might term a mental condition.
Well, there's a Venn diagram of TBI symptomatology and PTSD symptomatology, and how many symptoms of PTSD and TBI overlap.
Mm-hmm, yeah.
It is absolutely clear and proven that people can get PTSD with no physical injury to their brain.
Okay, so now let's go back, because I've heard this elsewhere, is that stress can cause inflammation of the brain. So
Yes.
you're under extreme stress. In fact, they've shown, I think there's numerous studies that will show it can limit your lifespan. Stress actually, will take away years of your life, and a lot of that is manifests in the brain, where you're getting inflammation, much like this physical injury. It's causing inflammation in the brain. One of the meetings that I was able to attend was at the VA with a chief at the VA, and it was a chief psychiatrist, and we were trying to get there was 3 chiefs there actually. I think that's the higher level within the VA.
No Indians, just chiefs.
The 3 chiefs, one was a research chief, or he was the head of research for the VA. This was in Durham, North Carolina, right next to Duke Hospital. In fact, they all had other jobs at Duke. They were teachers, professors, working in the hospital, I guess. And one was the head of psychiatry, one head of research, their laboratory, and the other was the head of some very interesting, trying to remember, he was in the nanotechnology area, I think, of cellular brain issues.
There's roles for nanotechnology in brain wounds.
Yeah, so anyhow, they were all there, and we're just trying to understand their depth of knowledge that a traumatic brain injury would and likely cause inflammation. And
Did they come knowing that, or they learned that while they were there?
They said that they would not acknowledge that unless there were studies that proved it. Okay, so this
is what year?
This would have been probably 2019. Yeah, so we had that conversation, and just knowing that hyperbaric oxygen was this powerful anti-inflammatory, that would have been the next question. Did they know that? but we could never get past the fact that a traumatic brain injury causes inflammation. So taking that a step further and back to that earlier comment is that with stress, they've proven that it causes an inflammatory response. The stress of the loss of a loved one, divorce, all these things do cause inflammatory issues, which leads to depression, anxiety, lack of sleep, all of these things.
Well, let's be clear about why a lot of that happens. When, like your ankle, when you sprain your ankle, i.e. twist, tear, bend, and inflammation sets in, natural body process, blood flow is reduced, blood flow. And one of the things you always want to do is get blood to a twisted ankle. Same in the brain. Inflammation leads to reduced oxygen delivery, which leads to, surprisingly, reduced mental function.
There you go. So
hypoxia.
Yeah. So
pilots like myself understand hypoxia. You go up high on a mountain, you learn about hypoxia, and what is the result of mountain sickness? Death if you don't, increase the pressure by going down the mountain. That is the protocol for mountain sickness. Go down the mountain and increase the pressure, and miraculous.
That's why they have those bags that you can
right
put
away,
a little pressure bag, up in the mountain. So interestingly enough, in this situation at the VA, these are the top officials, and we're there with Sergeant Major LeMay and Jim Hooker, who we'll love to get in here on one of these conversations, and that was the focus. We had books of data, and Jim is famous for organizing so much data, putting it in a loose leaf with tabs, and giving them to everybody at the meeting, and he's giving them this information, and you think they would even open it. They're not interested in knowing that a traumatic brain injury could cause inflammation. Meanwhile, we know that when it's so severe, they're actually putting pressure gauges, and drilling holes into skulls to make sure the pressure doesn't go beyond a certain point, because they're gonna have to relieve some of the brain fluid, because it will kill you, right? I mean, there is John Grant's story, where Laura Grant talks about the basically the gauge they put in his head.
We have evidence from archaeology that ancients understood pressure on the brain.
So my question is that I know that they know the answer to this. I believe that they didn't want to answer that question because they also may know, I don't want to accuse them of knowing something, that hyperbaric oxygen is the most powerful anti-inflammatory, I think, natural anti-inflammatory known to exist. And then they're not getting past TBI, and that it's an inflammatory issue. Why? Why are they so afraid to just say yes?
Well, here we are back to medicine, medical school. Fascinating to me, interviewing recent medical school grads and learning how little they know about hyperbaric oxygen. I talked to an anesthesiologist who, though he knew about chemical brain fog after surgery, had never been told about hyperbaric oxygen to clear brain fog. Never heard. An anesthesiologist from a very prestigious medical school.
Would you know that
had never heard of it.
Do you know within the FDA, the hyperbaric devices fall under the anesthesiology division of the FDA?
Well, it's both a drug and a device, and so
it's considered it's in the anesthesiology group.
Well,
and how could they not know this? Like, are they?
I have interviewed dozens of new medical school grads and even docs. I mean, I constantly, when I go in now to the hospital, I'm asking, and I'm somewhat famous or infamous in the surgical ward for how quickly I heal from knee and hip surgery because I pre-oxygenate and post-oxygenate with hyperbarics, and everybody who does this understands 30 to 40% faster healing. I mean, we have more and more and more, hundreds and hundreds of professional athletes using hyperbarics for inflammation, for pain, for recuperation. Ask Novak Djokovic why he has won so many awards, and Michael Phelps and LeBron James. They know the power of hyperbarics for general body wellness and fighting inflammation. Mm-hmm. So asking a psychiatrist, for example, what's the best way to fix a traumatic brain injury? Well, his Bedeker's guide, the desk manual, is all about mental health. And so if you look at, and this is what's fascinating, and in NBIRR we got started in this, to look at the clinical practice guidelines for the treatment of PTSD and traumatic brain injury. The clinical practice guidelines, nowhere is hyperbaric oxygen mentioned. Mm. They work on the basis of symptomatology, and seems like there were 47 different symptomatologies, and it's a giant spreadsheet of if they have this and this and this and this and the comorbidities and so on and so forth. This is why we see so many vets with 23 or 47 different drugs that they are taking.
And have they been tested?
No contraindication tables for that many medicines.
Have any of them been tested in combination?
Well, yes, but not sufficiently. Not sufficiently. I don't want to put down the role of oversight. And some of these docs, they desperately want to be able to help. Driving here today, I was on the phone with a vet who is, 11 years post-injury. He has never been diagnosed with traumatic brain injury, even though he's been blown up 3 times. He has 100% disabled, and he has a PTSD diagnosis. We know, for example, that General Corelli, going back to 2010 or 11, when he oh my goodness, I didn't realize it caused this much damage. At that point in time, because of the work I was doing, I know that they were trying to understand downrange what happens after a blast. Let's get data. So they called it the Traumatic Brain Injury Database. And we were thwarted in putting a real legitimate database downrange, and mirabile dictu, all of the data from the TBI data collection disappeared. And we know, because we were told by 3 colonels, that a certain lieutenant general said out loud, "I am tired of all these traumatic brain injuries. It's PTSD." Now, PTSD, post-traumatic stress disorder, is a personal problem, whereas traumatic brain injury is a physical problem. And so you can have a general in Texas scream at his company of men that they had to man up.
Yeah.
You're not hurt. Anybody who commits suicide because they've got a brain injury is a wimp.
Yeah.
Out loud.
Oh yeah. That's
So
awful.
but the bottom line here is that the mental health universe that medicine lives in, and traumatic brain injury and PTSD and post-concussive syndrome fall in the mental health basket. And when you make it a mental health problem, it's almost as though by willpower you can convince yourself that you don't really have a problem. Well, and I genuflect to so many folks in the VA and in medicine in general who want to do the right thing. And this fellow talking to me this morning, he works in the VA and he cannot make headway on, number 1, letting people know he's got a traumatic brain injury, and number 2, that everybody with a traumatic brain injury should be told about the availability of this treatment that seems to work. So he's frustrated from within the system, and he carries a brain injury.
Okay, so we get to the chiefs at the very top of the food chain at at the hospital, and they don't want to admit that it's inflammation, but they know it's inflammation. What are they afraid of?
Well, you're describing inflammation as though a traumatic brain injury
causes
inflammation.
Can cause inflammation.
Well, I don't know what the percentage is, but in all likelihood, if you've had a blast injury, you have inflammation not just in your brain, in every organ in your body. Absolutely. Because that blast is ruining your whole body at some level.
So why would they not want to admit that?
Well, here is my summation. We wrote a paper, The Obvious Question. Since HBOT works, why aren't we using it? Mm-hmm. It's on the website. And we came up with 14 reasons. And one of them, of course, had to do with the fact that drugs and prescribing drugs to vets is a big business, gargantuan, billions and billions. And we know that people who get 40 treatments or more with HBOT get off almost all their drugs. So we're carving into market share by treating and healing. But that's only one of 14 different reasons. If you are never told in medical school that blast or attack on your brain in some way, shape, or form causes inflammation. Now think of 3 doctors at Duke who don't know that brain injury causes inflammation, even though it's been known for 50 years. That's a lack of training.
Well, so, one of the questions that I hear, you should not ask your doctor if hyperbaric oxygen is good for you, for whatever you're dealing with. Ask them what they know about it. Because they'll be honest and say they don't know about it. But if you ask them something and they went to medical school and they've been practicing for 20 years that they should know, they're going to tell you, no, it's not good for you.
It's a good device. We have a form that we give to veterans who find us. It's on the website. And it's literally a declaration to the doctor for veterans that says, I believe that I have a brain injury. In some cases, they've been diagnosed with a brain injury. I also believe that I am suffering from, and there's a list of the indications, and I believe that hyperbaric oxygen would be good for me. I believe that I should be told and counseled about all interventions which could be used, because by the Code of Medical Ethics, you are responsible for telling me about interventions from A to Z, not just what you know. Mm-hmm. And this is all about informed consent. Veterans are not being informed about even the on-label 14 indications, diabetic foot ulcers specifically, much less for traumatic brain injury. They are not being told. And we believe that in too many cases there is a concentrated effort to suppress the knowledge of hyperbaric oxygen therapy. Now we can go back in time.
Let's go back to the 14 things, because you gave us 2. The 14 reasons why.
Yeah, sure. Well, you got to read the paper. It's a mystery.
It's a mystery.
But here's
I will read the paper. And
here's a big one, absolutely big.
And we're going to put that link by the way, at the end of this conference, so everyone can read.
There.
This is why it's not working, and it's not just because of taking rice out of someone else's rice bowl. There's some other reasons. I mean, that's the disappointing, somewhat disgusting part.
Well, here's
and maybe the most powerful of the 14.
Here's a little episode that several of us encountered. We were on the Hill, and we were meeting with some very, very important staffers. And the staffers, as it turned out, came out of the world of clinical psychology. And those staffers said to us, look, don't bother with this hyperbarics. Just give them to us. When you get the phone calls that people are having problems, just send them to us. We'll take care of them. And my almost immediate response was, all of the people who come to us have been failed by the very system that you're proposing to put them through. They have failed at least the 4 major interventions that the VA put up as their 4 top interventions, and one of them is cognitive psychology and the role of EMDR, eye movement desensitization, and the immersion therapy, the big 4, and of course psychopharmacology. So all of the people who come to us have failed at least 2, if not all 4 of those, including, and again, we have a long list we try and keep current, the over 180 interventions used at the VA, the Intrepid Centers, the NICO. All over this country, there are centers that the military and the VA have put together to deal with mental health issues.
So you're saying none of them use hyperbaric oxygen, or do they?
No. We're talking about the VA. They don't own a hyperbaric chamber the last time we checked. They may have one by now. The military has a few hyperbaric chambers, specifically down in San Antonio. They have a big burn unit. Duke has a gargantuan hyperbaric unit, but it's not used for veterans. The diving centers, Panama City, gargantuan, 9 separate multi-place chambers, which were offered to us by the head of that facility at the time to treat veterans. Couldn't get permission for it. Wright-Patterson, Travis Air Force Base, phenomenal group of guys out there. And we're working very hard to get the military to use their chambers. Now remember, NBIRR, the study, used private clinics, private money, credit cards, donations to treat and heal 32 individuals, and those treatments proved safety and efficacy. It wasn't big enough, but following the NBIRR study, there are now 20 legitimate scientific investigations, to include randomized controlled trials out of Israel and the United States primarily, that demonstrate safety and efficacy. 20. They're all listed on the website.
What does it take to get a drug approved?
Well, interesting question. Again, I talked about phase 3, phase 2, and phase 1 studies.
These are peer-reviewed studies you're talking about.
Oh, every single one I'm talking about is peer-reviewed.
It's like a phase 1? Is that it?
Well, a phase 3, let's see, which way does the pyramid go? But the crown jewel is the randomized controlled trial. Mm-hmm. Way down at the bottom is just evidence collected in a clinic, and then an observational study where it's done with good data and so forth. And then there's crossover studies. But as you move up the pyramid of investigations, you want it randomized and double-blinded so that patients don't know that they're getting the sugar pill. This whole randomized controlled trial, by the way, didn't come into being until 1968. And penicillin, for example, never had a randomized controlled trial before they were making tens of millions of barrels and getting it overseas because they knew it worked.
Because the infection went away.
So 60% of all drugs and interventions with children have never gone through a randomized controlled trial, because you can't take a baby and say we're not going to give them something that we believe works. 60%. So we're looking at an investigation process which could be, let's say, cleaned up. I'm not opposed to randomized controlled trials. They're wonderful. But in the world of hyperbaric medicine, this isn't sugar pill versus drug. Right. This is the sham for hyperbaric oxygen is difficult, if not impossible, to achieve.
Doesn't apply. So okay, so I want to circle back on the NBIRR study and maybe ask one final question. Is that in that study, it seems like there was a tremendous amount of effort and a lot of volunteer and sweat equity on top of personal donations, to get that study done. Was there see forward motion in the effort? Did you get a benefit from that, from outside of the 32 souls that you helped? I mean, because there's certainly, the great feeling to see that. Beyond that, was there some forward motion in this effort?
Well, it's difficult sometimes to know where you're having an impact. Certainly in the context of a marketing tool to other clinics, that by participation in this network and collecting data, they might be able to help us get HBOT on label for traumatic brain injury. And so our network grew. That was a direct benefit. Further, by publishing NBIRR, there were, science is a strange thing. There's a maxim that it's going to take 17 years from the introduction of a revolutionary idea before it becomes accepted practice in medicine. And along the path of those 17 years is nothing but pain and suffering. And our experience with NBIRR is that our network grew in terms of the number of doctors who started calling us and asking questions. So education is a big piece of what we do in the TreatNow Coalition, educating Congress. We were able, Marty and I would go to Capitol Hill and we could put the study down on the table and say, because the Army hadn't come up with the end of their study yet, actually they had done, Paul Harch had gotten a study, and I can't remember which came first, but the combination, the weight of the evidence that was accumulating in combination with the Israelis, and even the Army's own studies demonstrated that the data showed safety and efficacy. And if we're being honest, Congress, in overseeing the VA, has the responsibility to pay attention to science. Science equals safety and efficacy. And the role that the FDA and CMS and insurance companies play in making sure that people get the treatment which is safe and effective, and we hope cost effective. And we can talk later about how much money is going to be saved by treating brain injuries as opposed to not treating them. But NBIRR was, again, another finger on the scale, demonstrating to those people who were disbelievers that we now have more evidence than before. How much evidence is enough? Somebody said to me, a psychologist, by the way, a Ph.D. in the Navy, anecdotes are not evidence. And I said immediately to him, how much evidence equals one fact? We were showing him all of the studies. And, what is a fact? And you can argue data, you can argue facts, you can argue science, but at the end of the day, the overwhelming body of data collected under the most rigorous scientific measures demonstrates safety and efficacy. And we're hoping that the FDA and CMS and the VA and medicine in general will somehow awaken. We're hoping that the president and his wife will pay attention to hyperbarics the way they have to burn pits. The role of oxygen in helping clear, again, back to anesthesiology, burn pits, bad air, toxic air, brain fog, depression, toxicity. So we're hoping that all of the work that we do, and you ask, how am I not depressed? I'm optimistic because we're gathering so much more evidence and publicizing the evidence, and increasing numbers of people are calling and asking the obvious question. Since it works, where do I get it? And how come it's not insured? That's a subject for longer conversation, which I hope we'll have.
Yeah. Well, no, it's I think it's insightful, and it's good to hear that the study was not a waste of time.
Not at all.
And it's just another arrow in the quiver, right?
Mm-hmm.
Getting closer to when it's widely accepted and used more around the United States, because it is used in other countries.
Oh, Ed, when you look at just the uses of hyperbarics for COVID, I mean, it's amazing the number of countries. Italy is doing amazing work. China, Japan, the Philippines, Germany.
For COVID.
For COVID. Israel, I go on and on with all of the countries who are desperately trying to figure out how to deal with the long haulers and think about what a long hauler is, an hypoxic suffering patient, hypoxia, lack of oxygen.
No, we
to
had,
all body systems.
Well, we had Elena Schertz in here talking about the long haulers coming into Ex Divita and seeing just how quickly they responded to hyperbaric oxygen, how it helped them in I think 10 treatments, and they felt back to themselves. So really rather quickly. Well, I'd certainly appreciate you coming in today and spending the time with us to go over this, and look forward to having you back. So
it's always fun with you, Ed.
thanks, Rob.
Thanks for all you do.
Okay.